You designed the prototype for the Star Trek computer. Someone can sit down and in a matter of hours or maybe even minutes, someone can say, okay, here's the situation. How do I move forward? And you are designing that for the healthcare industry. I think it's freaking amazing. Where card or pick your favorite says, computer, what weapon systems are online? Or how many torpedoes do we have? And the computer is able to just rattle off, this is what you have available, this is what you need, let me reroute, let me do all this stuff. You essentially designed the prototype to be able to do that for the Army weapon systems during your time at Cybercom. And what you did was, how do I design this for the healthcare industry? In this case, either the provider or the client to be able to sit down at a computer and say, what are the breadth of resources available to me? Which ones are suitable for my needs? And how should we move forward? Go. Under kind of more analog systems, it would take 20 different phone calls, 12 hours, and a whole team of people just to be able, 10 directories, and a whole team of people just to be able to get things going in the right direction, hopefully. So I just want to back up and frame this a little bit for the viewers, for the listeners, because this is actually really exciting.
One of my last active duty assignments was in United States Cyber Command, which is the military's combatant command to secure its cyber domain. And I ended up doing strategic acquisition planning for one of the cybersecurity organizations within it and received some really positive feedback that the level of planning that I was doing was the most holistic that my boss had ever seen. And I really understood technology and military and the NIST security framework and all of those things in a way that other people didn't. And I had been spitballing this idea of building healing communities and doing this thing that I find myself doing a lot, which is that people come to me and they tell me the symptoms and diagnoses that they have and their struggle with the health, wellness, and human services sectors. And they say, what do I do? And so I would help them, one, connect to the voice of their higher power. I would tell them the breadth of options that they have in the Eastern, Western, and alternative care models. I would tell them about holistic healing and how there are several domains of your life and how you need to care for each one. And so I started saying these things over and over and over again. And one day someone had asked me to do a proposal for a speaking gig. And I have a keynote speech that talks about this 7 domains of care. And it's really chronic illness reversal model that I talk about in my book, Heal or Die. You said, it's not enough for you to share that with 50 people in a room or 200 people in a room. Even if you did that every few weeks for the rest of your life, you wouldn't be able to really have an impact on the size of the problem, which is that 80% of US deaths are caused by chronic illness alone. Never mind other complex illnesses, the rare, the genetic, the congenital, the injury-caused illnesses that affect multiple systems of your body and multiple domains of your life. And you need coordinated collaborative care across health, wellness, and human service professionals in order to get out of that rut. And you just can't in most situations right now. You said you need to really scale that. How do you scale that? And I was like, well, technology. That's the only way that I know of. And he said, then build technology. So now I'm a Master's of Science student in information science at CU Boulder, where I'm learning how to prototype a health website that bridges these systemic gaps. And there are many features, talk about it in another podcast, but the first one's going to be matching patients to professionals across all of the breadth of healing models and domains of care that I tell people all the time, but let me build a recommender service to do that will allow people to improve their health literacy just by experiencing the search features and filters on this professional directory. Not just healthcare, but health, wellness, and human services. So everybody across the 7 parts of a person, the spiritual, psychological, physical, environmental, the capital, which is like your resources, not just your financial, but your social capital and all of those things. The social and the influential, right? The way you influence or leave a legacy. So all of these areas of your life can be affected by illness, by complex illnesses. And there are people who offer services in specific slices of each of these domains, but there is nobody right now in U.S. healthcare, wellness, or human services sectors who helps you coordinate all of them. Like social workers kind of get close, but the most integrated care that most people provide right now is psychological and physical. What about the spiritual? What about the environmental? What about the social, right? Those things are not considered. And so the prototype is targeting minutes, not hours. The hours would be for if you wanted to have the system help you do some initial screening and stuff that we're not doing right now. But there are many, many features that we can offer. The first one is this patient-provider matching.
And for any one of our listeners or viewers who are interested in learning more about what we're doing and how you can support, you can go to benescompanies.com, and there are resources and information on how you can support or what you can do to learn more about what we're building. It's freaking amazing.